All right, if everybody wants to take a seat, I think we'll be ready to get started. So welcome to our weekly orthopedic surgery grand rounds. So one quick thing, Dr. Theologis asked me to announce that he is hosting an AAOS webinar with some of our faculty on spine and hip disease. So I believe that's tomorrow night, but should be a good session if anybody's interested in attending. We have a special visitor here today. Dr. Miklau will introduce, and then Dr. Ma has an announcement for our group. So,
hey, team, thank you so much. Just quick things of reminder for the faculty, we do have the Innovation Ventures talk tonight. It's totally not mandatory, but just some information for faculty if you're interested in innovation. What is the process at UCSF? A couple of faculty have gone through it before, so I think it's something that is good to listen. You could do it on Zoom, so you should have it on your calendar. Register for Bones Ball, guys. Okay, so graduation is coming up over there. It's a senior resident. We need to celebrate, their graduation. Also with their fellows. Also, please register for Bones Ball and also for Im and Abbott because we want to get some head count and plan for the event. So coming up soon. So thank you.
Thank you, Ben. So this, it's really wonderful pleasure to actually have Dr. Gee here with us. We got a chance to spend time with him yesterday. A few of the fellows went out. As many of you also will remember him for, he leaves his mark wherever he goes. And Pierre, I don't remember if you remember this, but the first time, so Dr. Gee and I wound up having quite parallel ventures together. So he did a fellowship at Hanover and then followed up with one in Berlin. And so I'd start out his introduction by saying how I was introduced to Dr. Gee. And so I was in Hanover after he was in Hanover, and they kept saying what a great fellow we had coming through here. And I kind of got sick of it, listening about Dr. Gee. And then I followed him. He was in Berlin. And so then I went to the next place from Hanover to Berlin. At the time, a lot of the leadership had also switched from Hanover to Berlin because Harold Cherny, who was one of the pioneers in orthopedic trauma and trauma in general in Germany, had sort of his lead person took over in Berlin, and Dr. Gee was over there with him. And so I wound up going to Berlin. And as soon as I get there, I hear again this Dr. Gee thing. And I was like, Jesus, I have to follow him over here now. And so they said, okay, well, for your first day, why don't you just go into, OR8 and Dr. Gee is in there. Seriously? So I went into OR8, and the way that they had the rooms in Germany was there was a pre-op and a post-op room. And so it was, and then you had your main operating room, and there was an anesthetist in there. And I walk in the room, and it was a cervical spine case. And it was Dr. Gee, and there was nobody else. There was not a German other than the anesthesiologist in the room. I'm thinking, oh my gosh, so what's going on? And so is this getting started? I said, yeah, come on in. I need the help. And so I scrubbed in on the case. It was a cervical spine case, and he was basically doing the approach. And later on in the case, the attending just kind of walks in. And this is a visiting fellow from Canada that's doing that. And so what he lived up to his name to me is I had, at that point, utmost respect for him. He had told a story about how he was in Germany, and then the patient had a PE, and then they closed the wound and opened the chest. Well, back in that training, they trained on a lot of different things. And it was very clear from the beginning that this is a person who was competent. He was reliable. They trusted him immensely in a short period of time, and extremely capable. Over the years, he's made his mark in orthopedic trauma. He, after that period of time, he's from Montreal, but had moved over to Vancouver and joined a very renowned group in Vancouver, Peter O'Brien and Bob Meek. Sam was just the Bob Meek lecturer. And Pierre has sort of stepped into their footsteps. He's one of the founding members of the Canadian Orthopaedic Trauma Society, which has wound up really, for orthopedics, been the model for how to get research projects done in a prospective way at not very big expense. So we have Metric, but we spend a lot more. COTS has been able to produce a lot of really seminal work on a small budget, and it's because they can collaborate with each other. The Canadian group is very tight-knit, and Pierre has been really responsible for doing that. He's known throughout orthopedics and orthopedic trauma as a strong educator and a wonderful colleague. So he currently now is at Vancouver General Hospital in UBC, where he's the chief orthopedics there, and he's the academic head at UBC, University of British Columbia, in orthopedic trauma. And so he's been a good friend of our group. We've had a couple of our former and current faculty that have been trained here. Jeremy LaRouche, who many of you remember, Pierre trained, and Mark Sue, who's here, also was one of Pierre's fellows. So Pierre, welcome. He's a very thoughtful guy. He could have talked about one of his areas of expertise, which includes pelvic and acetabular work and hip fractures, but instead is going to be imparting some information on things that he's thought about here on planetary health and what can we do as an orthopedic surgeon. So please, a big round of applause for Dr. Guy.
Thank you, Ted. There's a long story with the whole spine thing, but we can talk about that at a time. I truly enjoyed the evening last night. I had to throw that in. We went to a ball game, and that's the best professor dinner so far I've ever gone to. If that was yeah, I got thrown in there. That was great. And then I have to tell you my side of Ted McLeod. It'll be a brief story, but Ted and I met, as he said, on 2 occasions once, and those were 2 leading centers in trauma in Germany and in Europe, probably the world. And in Hanover and in Berlin. So Berlin, you have to think this is, can we say, 1995. That's a long time ago. And but 1995, if you imagine, that's just when Berlin had switched over from being East Germany to West Germany. So everything was still in transition. So probably a club that existed one night, you would go the next night, it was not there anymore. So lots of these things were happening. And well, because of that, I can't mention all the stories. So we'll just move on. But so I wanted to talk about this topic. This is not the nuts and bolts and plates and screws and this operation versus that operation kind of presentation. I think it's still an important topic. I was telling Sam, who picked me up this morning, that my other interests would have related to talking about DAGs and talk about different analyses for assessing risk and for patient. But let's not do that. Let's do something else. And I spoke with Ted last week, and he gave me the freedom. So he said, "Hey, talk about whatever interests you." And I said, "Okay, I'm in San Francisco in California. I probably could not give this talk at UT Southwestern or Texas or something. So nothing I don't want to, grossly be, making statements here. But anyways, this is recorded and online, is it? Fantastic. I'm gonna send a link to Chip. So my disclosure, I have no conflicts of interest related to this topic. I'm a consultant for Stryker, but it's not related. The opinions are my own, and the facts are the facts, and they're for everybody. These are our 3 children, and then this presentation is about them. But it's not. I mean, it's about them. It's about youth in general. But I'm going to ask anybody in the audience to raise their hand if they have any children. Okay, if you have any grandchildren. Okay, do you have any nephews or nieces? Okay, so this talk is about them. Now, have you ever been affected by severe weather, fire, or smoke? That's everybody. So that usually picks up everybody, particularly in North America and certainly here. So this presentation is about them. This presentation is also about these folks. These are our residents. They have an annual retreat, usually. And as I'll talk about later, youth are significantly concerned about this from a mental health point of view, about the future of our planet. It's also about these folks. So I showed you pictures of groups that are, in developed world where there's probably ways to mitigate or protect themselves from the climate changes, but there's some children in the world who probably don't have that. So I'm just going to say that anything I'm going to say here is for your consideration. I'm not trying to convince anybody. I'm not a climate scientist, and I'm not an activist or a preacher person. If you know my personality, and Ted does, it's really just providing information. You can still call me an ally, but I'm a constant learner with this. I just want to warn you that this talk could be hard. It might challenge some of your beliefs and some of your everyday activities, and if it might upset you, and I'll say sorry. I'm going to say sorry because Canadians say sorry all the time, but I'm going to say sorry. The info or try to reference is really good sources about this, as you can tell, and I'm going to point out Cascades Canada, which is a great organization. So the source of inspiration is my wife, Linda Thayer. She's a family physician. She specializes in sports medicine, and she is, I would call it an environmental steward. She cares for us, and as the expression goes, in all our relations, and she deeply cares for Mother Earth, for her kids, and for anybody in the future. She reads a significant amount. She teaches, she writes, she reflects on it, she takes action. She supports people like me who try to convey messages about this. She challenges us. She challenges me, and then this is why am I doing this? So I've been fortunate enough to be involved in these various leadership roles, and now I'm president of the Canadian Orthopaedic Association. So she says, so that's an opportunity. What are you going to do about that? So I said, well, I'm going to do this. So here I am. I want to acknowledge a couple of other physicians, Dr. Rashmi Chadha, who's a pain specialist at our hospital, who is also involved in this, and Douglas Courtemanche, who's a plastic surgeon, but also involved with this along with my wife. They started this organization called Doctors for Planetary Health. My objectives describe some facts related to climate change, specifically focusing on global warming and waste management, decide what you could do locally, and reflect on maybe meaning at your hospital, and reflect what you could do personally. And UN has 12 different actions you could consider. UN Environment Initiative has like a triple emergency for the climate. We're going to focus on climate change. We're going to talk a little bit about waste, so pollution, but really on that. And what is it? What it's really extreme variations in the Earth's climate that we would see as changes in rainfall, or like up or down, so lots too much, or drought, or unusual temperatures. And that has a significant effect on the planet. And you can say, okay, why is he talking to me about this? Because it actually affects health. And because as physicians, I'm going to tell you right now, we're trusted members of society. We actually have potentially a way to impact that. So what's the importance of sustainability to you as surgeons, medical professionals, scientists? Just think about that. You don't have to raise your hand or anything like that. Do you think you're more in this is very important, this is important, this is not really important? That's totally fine where you are. Like, it's completely, accepting environment. Anybody's on their path or their journey. One thing that's convinced me to do something about this is actually when my wife said, we're going to have to do something about this one day or another. Do you want it to be hard, or do you want it to be really, really, really hard? And that's where I thought, okay, maybe we should do something. Okay, so if you look at various surveys that have been done, the Association of Surgeons of Great Britain and Ireland, who talk about that, who should be responsible for this. So try to think about that. Who do you think should be responsible? Should be anybody who's contracted the hospital, consultants being surgeons, managers, sustainability managers, or hospital executives? Just some thoughts. You don't have to answer a survey, but people thought that it would be people from the outside, not necessarily consultants. And I would say we probably have a place to do that. So that number we should probably consider ourselves as actors in this. When considering procurement of new products for use, how much consideration do you give to the environmental impact? I don't want to point out any specific device, but if you are going to put a suture with a little flip piece of metal on it, and you're going to use it just one time, would you give consideration to the type of device that we use? And in any company, and this is not specifically this company, but any company will have that. And if you start pausing around that, the things that you have in the operating room, anyway, so 50% said no, never think about that. Sometimes, so that's like 80% of people, 90% of people said, and then just 10% of people say it's high. It's becoming an increasing criterion for decision making at our place. A team briefing before you start surgery, do you ever think about what you could discuss in the operating room? Are you going to open the cautery every time? Are there things that you might not want to need to open for this? So back to climate change. So climate change, how does it affect? Well, wildfires, certainly in British Columbia, every year was wildfires. I'll talk about Canada. It was a record year last year. Last wildfire season, 18 million acres. That's about 6 times more than our usual average. Like the whole country, the West essentially was on fire with huge, like 30,000, cities, 30,000 population cities being moved out, and all these things. Logistics of it were amazing. What is 18 million hectares? It's about the size of England, Wales, and Northern Ireland for countries. Or if you're going to put it in U.S. basis, it's the size of North Dakota. So North Dakota just wiped out by fire. So that's a pretty big state, North Dakota. Like it's long to drive one end to the other. They're going to bring out to relate it to you guys. It's what would be important if the wine country was on fire. So that's happened previously. I think that's a couple of years ago where there's fires here. And I think more recently, a significant amount of smoke from wildfire. So, it'll affect urban populations as well. They might not be treed, but there might be additional impacts of that from smoke. It's not just about fires, it's about flooding. So in Canada as well, the past few years, significant episodes of flooding. So it's these big fluctuations in the weather. You're very familiar with atmospheric rivers, I'm sure, here. And then if you look at a stat from early 2023 that showed, that about, 13 inches of rain falling in about 10 days or so, or a little bit more than that. So that was a significant amount of rain that has an impact. The landslides are very familiar here with the terrain, I guess, and when the snow is loose, and then having floods around the areas. I think that's the walnut orchard. And then drought. So that's the actual contrast. So you can have up and down significant drought. And these are all maps that are created by people who are specialized in this, and then pictures of the effect on farming. And California is not spared from this. So on the left is actually from last year, because of all these atmospheric rivers, was actually a fairly good year for drought. The risk wasn't very high. This is from the agency that monitors drought in the U.S. But if you compare that to just a couple of years prior, in May 2001, you can see some areas where it had significant lack of water and then increased heat. So these big fluctuations, essentially, the point of this is that the climate varies on a significant basis on a short term. Over the long term, you can see that people have looked at this, and there's been warming of our planet since the day that records have been kept of the temperature of the planet, since the mid-1800s. And then if you go to the more recent dates, the last 10 years on record have been the hottest ever. Last year was the hottest year ever on the planet. And then 2021 was 7th hottest, 2022 was the 5th hottest. So that trend is going up. And that's relative to a period of time where people have established as 1950 to 1980 as an average period. That's based, if you look at this in detail, people will say, what's that based on? So nowadays, it's actually based on 20,000 weather stations around the world. They didn't have 20,000 weather stations around the world in 1850 or 1880, but that's what it is right now. And just so you think, okay, this is just one group's analysis, multiple groups have tried to analyze data related to this. They all come up with a similar idea. It's a huge jump. if you look at it at a bigger scale, like, 11,000 years ago, we didn't have temperature records at then, but there's different ways that people will assess what the temperature was back then. And although there was some warming about 5,000 years ago, and everything cooled down afterwards, there's a huge spike back up only in like the past 50 years or so. So that's significant when you put it in that perspective as well. And again, different models that these people have done all come up with the same idea. So the goal is to limit the warming to 1.5 degrees, because we want to prevent global warming. It actually would probably be a good thing. There's a bunch of other things that would happen. So it's not a hoax, but let's say it was. What's the downside? So that's the cartoon I thought was just really funny. When people talk about this scientifically, I think, does this pointer work? If I do this, yeah. Okay. I just have to follow it here because I can't. Oh, yeah, I can see it here. So this is a graph that shows you the greenhouse gas emissions on the left. It shows you time, and it shows you what the outcome would be depending on which policies are actually enacted by various governments and people, essentially. So if you did all the current policies in action, you actually would by 2100, the global warming would still go to 2.5. If you did the targets only, it would be a little bit better. If you did all the pledges and the targets, you'd be better. And some type of optimistic scenario of that would be that. And if you were to, but what our goal really is to bring the global warming to this level. And then when we talk about sustainability, the idea is to keep the planet sustainable for life is the great target. So despite pledges that governments have done and all this, there's still a huge amount of work to do despite all that. And that just points out the trajectory, or looks at a trajectory of these potential strategies that have been put forward. Is the planet about 1.5 already? But there's some parts of the world, it's like, although that's an average, there's some parts of the world that are really hot already. Like the north of Canada is already more than 1.5. Canada itself is more than 1.5 already. And the planet itself is moving up there progressively. But I just want to point out, if you look actually also, I didn't point that out, at around the world, how that's going to develop, all these countries around the equator where low middle income countries are, those are the areas that are going to be significantly affected. And all these folks who live there are going to want to move elsewhere around the world. So there's going to be significant migration pressure. So you've heard about, you've seen this graph, like this is about pollution, but you've seen a similar graph for temperature. And these represent all the different meetings that have occurred, international meetings that have occurred, tried to solve this. And despite all of that, the curve is still going the same way. I'm going to come back to that. If you're not familiar with the greenhouse effect, and it's okay if you're not, the idea is that the sun will project, radiation, and that will create heat on the planet. And typically, more heat can escape than stays in, and there's a balance, and the rest of the system can compensate for it. What happens with greenhouse gases, this whole effect from the gases that are normally in the upper atmosphere block the radiation from coming out. And that's why we stay warm. And that's the major effect. And where these gases come from? Well, it's an easy answer. It's mainly from fossil fuels and bigger and bigger Humvees. But if you look over time, there's a correlation in time with the different fossil fuels, and you'll talk about oil, gas, and coal. And then if you break it down into different types of emissions, this is only for CO2. Those have increased over time. And if you actually to break it down to different types of greenhouse gases, this shows you the carbon dioxide I just showed you, but methane is also a significant component of this. And it's essentially, methane is what you hear about when it's called liquid natural gas. It's actually much more potent than CO2 in its greenhouse gas effect, like 28 times more potent. So that's an important thing to try to limit as well. This is like a Canadian talk. This is the per capita carbon footprint. You'll see I have another slide later. US, you guys beat us. But it's a significant amount. And it's just to show you the breakdown, and depending on your country, where that is, certainly areas like in Canada, where you need to heat your house, housing is going to be important. Distances between places are going to be significant. Transport's important. So just to point out the breakdown of everyday lives. Okay, healthcare is important. So healthcare actually has a significant global greenhouse gas effect impact. So this is a participation kind of component. Do you think it's 2.8 of the greenhouse gas? So you can raise your hand. That's okay. There's not like a score. Nobody's going to keep the score. 2.8%, 5.2% of greenhouse gases, 10.6% of greenhouse gases. Okay, good. So 5.2. So overall, around the world, 5.2% of greenhouse gases are emitted because of healthcare. In Canada, it's 4.6. But if the healthcare was its own country, it would be the fifth largest. Is there a voice from above? If healthcare was its own country, it would be the fifth largest emitter as its own country. So there's potential to do better. Okay, do you think that compared to their aviation industry, are greenhouse gases from healthcare higher or lower? So higher. Hands up for higher. Hands up for lower. Oh, I love this. It's higher. So greenhouse gases from aviation industry, not transport. Like transport would involve like all vehicles and all this. And then I know we always say aviation, and I have a whole thing about like why am I here physically, but healthcare is actually higher. So if you're looking for motivation to do something, so there's different things that I wanted to talk about when we talk about planetary health. It's about the health of the planet, but it's also the health of human. Courtney Howard is a family physician who covers emergency room in the Yukon. So she's quite involved in this, and she published this paper in the Lancet a little while back. And if you look at the bottom row of this, they're like nature's determinant of health. So extreme weather, biodiversity, soil, water shortage, temperature rise, sea level, all these things. And then on the top row would be how that infects individuals. So heat-related illness, you see that. If you have to be evacuated, there's lots of trauma, anxiety, mental health related to that. Smoke will cause you significant problems for breathing. Because of the global warming, things like mosquitoes and infections will spread differently. Then they'll have an environment where they could spread differently. So we're going to see a change in that. Of course, problems with crops are going to cause malnutrition. And as I told you previously, because people will have to migrate, that might cause significant conflict. And from there, pressures on health system and on all the determinants of health. So that's why we think about the impacts of climate change, and not just about, I got smoke or I can't go out play basketball. I mean, it is that, but there's much more to it. There's also a component of mental health, and this was a survey of 1,000 youth, 16 to 25, and all of these essentially have a significant amount of mental health issue, or feeling that they're left down and nobody's doing anything about this. What's interesting, though, is that people do think that there's something that can be done about the climate change. So in summary, I've told you that, greenhouse gases are important and overconsumption are important. It caused disruption in climate change, a significant impact over the past 50 years, impact on the planet, impact on humans. And it's more than the Earth can handle. And you might have heard the term ecological footprint. This is a professor from UBC, Bill Reese. And essentially, he's tried to calculate the number of planets that it would need to handle the resources and the waste that we create right now. So one being like we need just one planet and we're barely working. So his calculation, this is actually just a screenshot from this morning. We would need 1.82 planets to manage what we're producing, the heat-wise and waste-wise, than what we have right now. So we don't have that second 0.8 planet right now. So that's the whole idea. And this is going to hurt. Next slide. If we were to, everyone around the Earth live like the average American, I'm going to say North American, because Canada's not doing well either, we would need 5 planets So support. That's another point. So I know that's all really hard. So it's really hard. So I want you to take a deep breath. It's like tough information. And I want you to admire this Douglas fir. Like, I'm not a tree hugger, but I really, when I go hiking, I enjoy these massive things that have been there for like 200 years, 300 years, and go like, wow, you've seen it all. And they just tower up. Anyways, they're just massive. And I think they're just a good thing to pause and look at. So, all right, taking a breath. Climate change is preventable. So that's the thing. We got to spin this, because I'm not somebody who likes to dwell into the grass of, oh, the world is falling apart. Like, yeah, lots of things are happening, but there's actually nothing that's going to happen from us just dwelling on that. So I think it's orthopedic, but I think it's more action oriented. We have to do something about it then. And so by taking some action, so you could take action like the world leaders do in their Titanic, and they say, it's all settled. We've agreed to sign a pledge to hold another meeting to consider changing the course at a date yet to be determined. So that's actually not going to work. And as I pointed out previously, despite over the years, all these various accords that have come across, we've not seen any change either in CO2 emission or in temperature. So it'll need to come from us, essentially, is what the message comes down to. It'll be individuals taking action and moving things forward. So how do you do that? Some people have broken it down into this like lingo of micro, meaning your own personal footprint, meso, thinking in your community, and then macro, if you're involved or, somehow can influence the system or develop some type of process that's going to have an effect on everybody. So what about hospital-based initiatives? So if you're there, you want to do something in your hospital. Okay. Let's talk about waste. I talk about global warming. It is a bit related, because if you incinerate waste, it creates also heat, but it's also a bit of pollution. So what percentage of overall waste do you think an operating room generates every year? Shout it out. Just anybody, because I can't list down all these things. So 80%? What overall waste does an operating room generate? Like overall, like globally, how much of it is wasted? Like what? Yeah. So 30% of what we generate is a significant amount that can be potentially improved, and half of that's arthroplasty. I had to throw that in there. So I'm a trauma surgeon, but there's actually studies that have been done on that. I'll point those out. I'm thankful for Nicole Sims. I didn't mention them before. There's an organization called Cascades Canada. They have incredible resources for education. You can actually do a little course to learn a little bit more about climate change. And she put together this talk. Data focused mainly on Canada, but a significant amount of carbon dioxide impact or equivalent impact generated from operating rooms. Andrea McNeil, I'm going to point out, is a researcher from our site in this area. This is Maria Kojic. She's an artist, and then she tried to represent the amount of resources and waste that were generated when she required a mastectomy in 2019. And that's a representation that she had as a picture. So that's one person's operation, just to show that. And these are all things that are be disposed of at the end of her operation. So Cascades Canada has developed this different pathways to improve or to decrease our impact. And I'm going to focus on these areas over here. But you can reduce activity, or you can reduce the intensity of the activities. And I'm going to focus on these secondary drivers here as a list. Orthopaedics is a significant part, isn't it? Are among significant procedures in Canada. It's the same in the US. The average service produces 60% more waste than any other specialty. So if you think of all the packaging and everything that we've opened separately, and then of course as things get modular, there can be more things that are open. So this scoping review was published, and there's science behind this. Waste management. And then quantifying some of the areas of where that can be focused on. So what you could take care of, segregating, separating your garbage, resource consumption, scrubbing, for example. You could scrub once a day with water, but after that, if it's satisfactory, you could use less water. There's an impact of having alcohol, but given the balance of two, that's a positive. And then that there are various strategies that we could use with respect to our carbon emissions. And I'll get into more details of that. Avoiding unnecessary low-value care, avoiding various visits. I think probably in the managed care environment that you have in the U.S., that's being done and being driven by insurance companies. So maybe let's find a positive thing about insurance companies, and this could be it. If it's going to be looked at with that outcome in mind. And wide use of blood products. There's an organization called Choosing Wisely Canada, which will develop recommendations, and the Canadian Orthopaedic Association has been associated with this as an organization developing various recommendations to limit the amount of care that's provided, testing and all this, and various surgical procedures and tests that are being done. You can directly minimize emissions. Actually, if you talk to anesthesiologists, you can tell them that they can stop using desflurane. It's probably equivalent to any other gas they use, and it's got 20 times more of an environmental impact than anything else. It's been taken off, like it's not used by anesthesiologists in our hospital anymore. And the Canadian Anesthesiology Society has just put out a statement around that, so it doesn't need to be used anymore. And then the other one would be to get rid of nitrous oxide, get rid of nitrous oxide piping, because there's always leaks of nitrous oxide everywhere, and it's hugely, it's got a huge impact. Like if the other one was, if methane was 28 times worse than CO2, nitrous oxide is 300 times worse. So you can get rid of that. That's worthwhile. Sustainable anesthesia options. Certainly wall-end anesthesia is a consideration. We're doing a study right now to look at, for orthopedic trauma cases, our regional, like systemic use of regional anesthetic to try to quantify our impact on that. Reducing waste is important. Most of the research in orthopedics has been around waste. Waste can be seen in many ways. It's, you develop some of these custom packs, like, you probably have that at your hospital. You do this operation, this pack will come up and all this. So you should actually look through those and see what you use and you don't use. Don't let the company decide for you. Could be one of the options. And then you could also have different choices in the purchasing. Example of that would be a paper that was published around standardized packs for hand surgery, going from the setup on the left standard surgery table to a really basic limited type of procedure with the use of lots of reusable scalpels and different instruments and all this, so limiting really this table setup. As you can imagine, there are a huge number of opportunities in the operating room to improve or decrease our impact. As I said, many of the studies in orthopedics have been focused on waste and landfill. This is an audit that was done for hip arthroscopy surgery. The average waste there was 9.4 kilos worth of garbage with a bunch of different categories. A study was done previously. They sampled the waste for total knee replacements, and they came up about 13 kilos of waste. And then they calculated that based on the number of hip knee replacements that would have been done in that year, 2008, 2009 in Canada, which was 40,000, 7,000, that it would have filled 2,000 garbage trucks of waste just from these procedures. So, just highlighting or quantifying opportunities to improve. Again, I don't really want to sound like I'm keep harping on the arthroplasty surgeons, but they win. So this is a breakdown of the waste. If you look at it, the preoperative, intraoperative, and postoperative, and if there are some things that you can decrease in your preoperative setup, but perhaps those are things that you can plan ahead of time. I was mentioned previously. Well, in this case, they have 70% of the waste is not recyclable, and we are 60% more than anybody else. So it's only a small proportion that's recyclable. So you have a message about that. Recycling was not necessarily be the solution, but there are some things that you can do forward. And this is a statement that we developed last year with Choosing Wisely Canada. It's just going to come out officially on May 15th. Essentially is to really sort the contaminated and non-contaminated. It's part about sorting the waste, but also that in the part that you sort, the part that's incinerated, you'd be kept to really what needs to totally be incinerated. Totally needs to be incinerated and not throw everything in there because there's a CO2 impact to that as well. So that survey, going back to that survey, when you're working in the operating room, how often do you ensure that the garbage is segregated? There seems to be a fairly large portion. The NHS has been quite active in this field, so perhaps that's transpired there. And some tips on how it could be separated more effectively, putting signs up. So, but the one important message is that we won't recycle our way out of this one. There's other things that we need to do. So that moves us to micro things that you could do on an individual basis. United Nations has these 12 actions for a healthy planet. I know there's only 10 there, but because I can't fit 12 in a talk. But these are things for you to consider. Again, I think as physicians and surgeons, we're primed for action. I think we understand science. We deal with science every day. If we're presented science, we can deal with that information. And then we can understand global warming. We've all done physics. We can understand some basic concepts around that. We can understand the effects on global warming on pollution and health. The effects of global warming, pollution on health. And then we probably, if we need to change something, we probably have some financial means to, if there's some financial barriers to, getting an electric car or something, we could do that. And importantly, we have social credibility. So if we do something as a group or as individuals, people will see that and potentially that'll influence them. Physicians have identified some of the constraints in being involved, time constraints and lack of knowledge. So, and then that's important. Futility in engaging the public, that's been identified as a barrier. A little support from peers and topic too controversial. So potentially, me hesitating about giving this talk. Yeah, it's too controversial. I don't want to go down. Just go and give a controversial talk. But Ted gave me the freedom. And then that things can be changed essentially because humans hate change, but essentially we need to tackle some of these important barriers. I'll get back to that. And how can that be improved? Well, CME on climate change. So this type of event, and then and how to make your workplace sustainable. So hopefully that triggers something like that around here. So things you can do on your own: save energy at home, wear an extra sweater, walk, bike, take public transport. I was just talking to Sam about that this morning, and he says he doesn't bike to work anymore. This is not a public shaming thing. You got an electric car. It's one of the things below, so that's going to be good. So I also understand that the BART's not also always safe to go back home into when you're finished a late case. So I think that's okay. Eat more vegetables and throw away less food. So 10,000 years ago, humans were about 1% of the protein, like live protein, and mammals were at 99%. And now we've had to create so much food that the wild mammals now only have gone from 99% to 6%, and the other mammals in the world are really domesticated ones that are meant to feed us. So only 6% of the combined weight of mammals on the earth is now wild. I'll skip that. Consider your travel. Okay, this is gonna sting. If you look at the emissions of CO2, the richest 10%, and yes, that's doctors, have 49%, account for 49% of the world population CO2 emissions. So that's a significant thing. And then this is where you guys win. This is on average population, the impact, the emission per capita is significant in Canada. If you look by country, partly because of population and consumption, China leads, and after that it's the U.S. So a significant amount of CO2 emissions coming from here. And we have to talk about our own flights. So considering that there's a significant impact of when we fly, like from Montreal to London or Vancouver to London, it's the equivalent of heating a European home for 1 year. And then if aviation was its own country, it would be a top 10 country in the world. Just a few highlights here. Although there's been significant improvement in efficiency of engines, like 1% to 2% per year, the air flying growth is double that. So, and avoiding one single flight could be equivalent of being car-free for 1 year, gas-free for 1 year. So there are some of the targets that have been identified. I'm going to go to this maximum allowable budget per person, which is about a ton of CO2. So like Canada, we're at 12, you're at 14, so we're already surpassing that. And then you're going to say, okay, you're here. Why are you here physically? Well, because Ted invited me. I'm declaring out, like I go over my budget, but this is an ongoing work for me. But my travel here is the 208 kilograms of CO2 equivalent distributed from Vancouver to San Francisco. So I'm going to blow the budget this year, I know, but I'm trying to decrease it from 12,000, which is where the average was in Canada previously. Air travel is associated with success. I like Taylor Swift, so I maybe share something personal here. So we have themes in the operating room. So it's Motown Monday, Taylor Tuesday, whatever Wednesday, Throwbacks Thursdays, and French Rap Fridays. So Taylor is a part of the week. So now you have 2 albums. It's gonna be a while. Anyways, so nevertheless, the air travel is associated with success, and certainly individuals who are quite wealthy do that. Is just to point out, if you start looking at the numbers, these individuals have much more than the average impact on the planet. Refuse, reduce, reuse, recycle, repair. These are things that you would think about. Refuse is more in this realm if you start reassessing all the devices that are presented to you, but there's some things that you can refuse as well. Like if you're going to have some kind of cause that you got to create a button or a pin for, maybe you don't need that. And then reuse, recycle, we're familiar with that because they're garbage. And the recycling, is there recycling with garbage here? Or yes, no? Yeah. It's an important part of our lives right now. And it's in our OR. So this is our OR, how it's set up. So every day there's mixed containers that get recycled, mixed paper. On the right in blue is linen. And then the yellow bins are for contaminated stuff. Change your home source of energy. That's a consideration. This is our whole old house in Vancouver, built 1910 or so. Picture on the right. And we're taking on this huge project of his air leaky house to make it more airtight. We're going to switch from gas to heat pump, and then and we're increasing the density of the population in there. So we're going to have another lodging in the basement. Make your money count, just so you know. There's you can invest in renewable energies. I'm not telling you divest. I'm not marching out here, divest from fossil fuels and divest from other, but just consider it that there's other options for you, and they're doing pretty well. And then potentially speak up, or you do research. So this is Andrew McNeil. She's a general surgeon oncologist at our hospital, and she does research in that field. She's developed this framework of reducing demand, matching the supply to the health services of demand, and reducing emissions themselves when we're providing services. So she does research on that. And it's also, she has support from our health region. So, healthcare in Canada is all public. So it's divided in regions, and they've established a VP of sustainability. And that's her. So she sits at all the top meetings. So when you have that level of support, you can make things happen. So then you implement. So as I said, she's VP of sustainability. So from anesthesia point of view, told you avoiding desflurane, moving from regional to general anesthesia. They did a study for breast cancer surgery where they calculated the impact of that. Waste management. I talked about reviewing your OR pick list. So you should actually, if you systemically look through your OR pick list, see what you can take out. Different initiatives, patient warming, and she's just started with a grad student who's a general surgery resident as well. Patient plant-based diet, which is it's actually nutritious. It actually tastes good. They gave us the recipes, so we tried them at home, and it actually tastes really good. You don't have to be marching anywhere to do that, but know that the white coat has a significant impact. The reason for that is that doctors are trustworthy in Canada anyway. Globally as well. I'm just kidding. But we just understand your opportunity to have an influence on society as a doctor. Of course, we're much more than politicians and advertising executives that are way, way below, and but we're up there. So just food for thought for you. You can write. I told you my wife writes about this. She also will demonstrate. She's not like a violent activist, but they carry around a planet Earth that's on a stretcher that they like to do at their various demonstrations. A little bit of humor, a little tongue-in-cheek, but essentially with a message coming across. You don't have to do that, but if you want, you can. That's the idea. You can join a group, so there are various works groups, and develop position statements. This is our Canadian Psychiatrists Association. Nephrologists have done that. There's a huge amount of waste with dialysis, so they've reorganized care for that. Our anesthesiologists, I told you about that. Our ENT surgeons, and hopefully orthopedics soon. So I'm president of the Canadian Orthopaedic Association right now, and then our board has just agreed for us to have a work group on planetary health. My wife wants us to focus not on these trajectories that show doom and gloom, but also pictures that show us that if you do something, there's actually going to be a benefit. It's going to be green. It's actually going to be better. So there's actually like a positive thing to look out for, which I think is a good thing. And that there's actually nice nature to enjoy out there. This is Garibaldi Lake, close to Whistler from what we call Panorama Ridge. It's a long hike, but it's worth it. So what are your next steps? What can you do? Well, there's hospital-based actions that you could consider. You could inquire about different activities that are happening in your hospital. Maybe there's colleagues that are interested in doing this. You don't have to wait for permission for somebody to do something about that. You can actually start something. You can think about procurement, as I talked about. You can consider your briefing. You can think of eliminating surplus, standardizing your list. Speaking with an anesthesiologist, we speak with anesthesiologists all the time. So maybe we could talk about that. Look into your waste management program. These are things that are potentially easily start up. Your personal actions. I showed about the UN, and you could potentially gain knowledge. Ooh, I might go backwards. Oh yeah, sorry. So thank you for this. This is a picture of our 3 kids. The COA has a YouTube channel. We've had a couple of webinars on sustainability and planetary health recently. And then I told you about this organization called Cascades Canada, and they have good resources for you, including courses and all that. And that's all I had. I just want to thank you for your attention. I want to thank Ted for when we had a chat. So just go for it. So thanks.
All right. Thank you, Dr. Gee. That was great and very thought-provoking. And I think we have time for maybe 1 to 2 questions. I see Rosie's hand up.
Thank you so much. That was great. I actually have a comment and then a question. So we have the Waste to Art Challenge. Is anyone familiar with that? So I'm submitting, Alicia and I are submitting OR waste to art. And so just if you want to help, I'm taking volunteers. But
So tell me more about this. What is it?
Okay. So it's university-wide challenge to take hospital waste and turn it into an art installation. So we're taking all the OR waste
Good.
Yeah.
That's really good.
So I need some help. It's due May 9th. So please join us.
That's fantastic.
What we're doing is Lady Justice. So we're making a full-size sculpture with paper mache from the drapes and all the trash to say what's the benefit to our patient and what's the harm to the environment. And there's so much trash. So
fantastic.
We have so much trash. My question is, I've been collecting all this trash, every day, and there's foam. Like, why are we using foam and not reusable gel pads? But my big question is, we use so much gowns, like the paper gowns, and they're really hard to recycle or paper mache because they have that cloth cuff.
Yep.
So you think, oh, okay, it's just paper. We could do something about that. But then there's this random cloth cuff. And why are we not using cloth gowns? And has there been a study to show that we're really decreasing infection with our paper gowns compared to cloth gowns? And same for drapes. Like developing, low to middle income countries often use cloth drapes. And is it really the drapes that are changing our infection rate, or is it everything else in the environment and antibiotics?
Yep. So about the gowns. So at our place, they're Gore-Tex gowns. We don't have, we have some paper gowns that are still coming into the packs, right? And there's still some surgeons. So there's not like a mandate, like one must use Gore-Tex, but it's like 95%. It's Gore-Tex. It works fine. It can be reused. There's different grades of it. So people who are close to the field have a level 3 or 4. Scrub nurses or scrub techs are further away. They don't need this. But essentially, at the end of the case, laundry brought back. You don't put a cast on with them because you're going to damage it. It's like, you be careful. There's some things that you do that are being careful, but not, ridiculous. And then with respect to drapes, we're not there yet. Like I traded in an era where we did have cloth drapes, and we've switched over to paper. We're working on that, and the evidence shows no difference. So go at it. The problem with these gowns is that the paper is not recyclable. But from the facilities that we have, not recyclable because they always have this rubbery component to it. That's a good barrier. I mean, we need that for safety. So that's not. But there's gowns that exist. There are vendors that make them. They're totally, that's totally manageable. And then people bring up the argument, okay, well, you have laundry and then there's phosphates and that's, but the impact of those is less than what we have for waste from that point of view. So that's the answer to that one. So I actually took out a picture. I have a picture of a spine surgeon, spine surgeon and fellow nurse and all this, and it shows a bunch of things that are happening in our operating room that one of the anesthesiologists I was doing a webinar with recently wanted to have. So I took a picture of it, and then I took that out of the talk just to make sure we're on time. But yeah, that's totally an option, doable. It's a bigger scale thing. If you think from a project point of view, for a hospital to commit to that, it's a bigger thing because you then have to source laundry, but all these other things have to happen as well. Yes.
I think Dr. Mikla had a comment, and then I think we'll have to just
I know we have to close it.
Yeah.
So I'll turn my question into a future to be asked question for you. But first of all, this is way more important of a topic. As much as I'm sure I would have loved the hip talk, this is way more important. Thank you for doing this, bringing it up. It depresses me to no end. And everything from drinking the water bottles. If you remember back in Hanover and Berlin, we used to have those green gowns that Rosie was talking about. And, now you just see them piling up in the OR, and it bothers me endlessly. And so thank you for bringing this up. And my question for you that I'll ask you to let me know later on is, one detail I didn't say in your introduction is you are the president of the Canadian Orthopaedic Association right now, which is a big honor. And you have influence, as you have had. And how is it that beyond choosing wisely and starting a work group, how is it that something like that can make a change in orthopedics? And so I know that it's a loaded question. We don't really have time for it now, but
just briefly, I think it's going to be at multi-levels. It's going to be surgeons talking to anesthesiologists and starting something locally as an organization. I think it's going to be facilitating people talking to each other about what they're doing and what's feasible, and go, oh yeah, I could do that. And then it's going to be us speaking with vendors. Would it have more weight if the American Academy spoke with the vendors? Absolutely. Like we're 10% of your population or less. So yeah, but I think that's that type of thing. So there's organizations, what organizations can do up and down is where I see it. So, and you had a comment or a question. I don't know if
I think we'll probably, for the interest of time, take it offline. But Dr. Keith, thank you so much. And I think a plaque to commemorate your visit. And thank you for making the trip down to see us.